Welcome. Today we're going to discuss and demonstrate the movements of the hip girdle in hip flexion and movement. The first movement is when the leg comes forward of the body. That's going to be flexion, demonstrated as such. Leg comes back. Leg goes forward back again to show flexion and returns. The next movement is extension. That's when the leg comes back. Excellent. Foot's going to come back forward, and he's going to bring it back one more time for extension, and then back forward. Next, we're going to talk about abduction. The leg is going to go out to the side laterally and come back forward. Go out to the side for abduction and come back in. Adduction of the hip joint is going to be when the foot crosses back across and back to normal. Once again, adduction and back across. Excellent. Now we're going to move on to external and internal rotation. We're going to externally rotate the foot by opening up the hip girdle and then bring it back forward. Once again, externally rotating the hip, bringing the foot back forward. Now we're going to internally rotate. We're going to bring the foot forward and in, bringing the hips close together, then back out. We're going to do it one more time, closing the hip, bringing the foot in, and then back out. Discuss diagonal abduction and diagonal adduction. First, we're going to go over diagonal adduction. That's when we bring our foot across the plane at a diagonal angle and bring it back down. Once again, diagonal adduction and back down. Next one, we're going to move into diagonal abduction, which is where the foot comes back at an angle and we're going to bring it back forward. One more time, diagonal abduction, an angle, and back down. Move into anterior pelvic rotation and posterior pelvic rotation. The first we're going to discuss is anterior pelvic rotation. This is an anterior movement of the upper pelvis. Iliac crest tilts forward in a sagittal plane and anterior tilt. So here we go up, then back down, back into neutral, and then going back up, and then back into neutral. Now we're going to move into posterior pelvic rotation. Posterior movement of the upper pelvis. Iliac crest tilts backward in the sagittal plane and posterior tilt. So we're going to bring the hips down in, then back out to neutral, back in, and then neutral. We're going to move into left lateral pelvic rotation and right lateral pelvic rotation. The left lateral pelvic rotation, in the frontal plane, the pelvis moves inferiorly in relation to the right pelvis. Either left pelvis rotates downward or right pelvis rotates upward, the left lateral tilt. Here we go, left lateral pelvic rotation, then back down. We're going to do it one more time. Up with a twist, and then back down. Now we're going to move into right lateral pelvic rotation, which is in the frontal plane. Right pelvis moves inferiorly in relation to the left pelvis. Either right pelvis rotates downward or left pelvis rotates upward. Right lateral tilt. Then back down, then up, and then back down. Next we have the left transverse pelvic rotation and the right transverse pelvic rotation. Starting with the left, we're in a horizontal plane. The pelvis rotates to the body's left. The right iliac crest moves anteriorly into relation of the left iliac crest, which moves posteriorly. So we're moving twist, and then back center. We're going to twist again, and then back center. The right transverse pelvic rotation is also in the horizontal plane. The pelvis rotates to the body's right. The left iliac crest moves anteriorly in relation to the right iliac crest, which moves posteriorly. So we're going to twist just the opposite direction, then back neutral. Then we're going to twist, then we're going to bring it back. There are various sports that use diagonal adduction. A few of those would be soccer and even American football. The use of the diagonal adduction in soccer looks a little something like this. as you would kick a ball or as you'd pass a ball. Moving into the sport of football, American football, obviously by kicking the ball once again, you're moving the hip in a diagonal adduction and bring it down. Pelvic tilt can be seen in the form of a sit-up when the body comes up and the body comes down. Once again, when the body comes up and the body comes down. Tilt is the correct pelvic rotation for squatting. As you can see, the pelvis comes back, back down, back up, and then one more time holding in a low squat. Pelvis is back, and then back up. In this clip, we have an example of abduction of the hip joint. The primary muscles involved in the movement are the gluteus maximus, the gluteus medius, the gluteus minimus, and the tensor fasciae lata. There are several muscles that make up the adductors of the inner thighs, including adductor brevis, adductor longus, adductor magnus, pectineus, and gracilis. No single muscle works alone. Not only do they assist hip adduction together, they also assist internal and external hip rotation, hip flexion, extension, and hip abduction. In the push motion of the leg press, the movement phase is a pushing phase. The hip joint movement is a hip extension, and the agonist muscles are the rectus femoris, the vastus latissimus, the vastus intermedius, and the vastus medialis. In the lowering phase of the movement, the hip joint movement is a hip flexion, and the agonist muscles are the biceps femoris, the semitendinosus, and the semimembranosus.